Recently, one of the viewer had asked about what is the difference between fits, seizures and epilepsy. In this video, we'll try to answer this question. Hi friends, I am Dr. Karamat. This is Scientific Doctor channel. In this channel, health related, medicine related explanations are provided via videos which are released every week. If you want to see such videos, kindly subscribe to this channel. Also, if you have any similar queries, kindly post it in the comment section. I'll try to answer them in my subsequent videos. This week's video is about these terms: fits, seizures, epilepsy. Now, what are these? We have to understand fits is not a medical terminology. It is a common man's term or a colloquial term for any abnormal muscular movement. Suddenly, you see a person on the road, in home, convulsing. These are called convulsions. Convulsions or fits is a common term for muscular, motor movements. Okay, suddenly happening. What are these due to? This is due to abnormal electrical activity in the brain. Brain has corresponding areas for each and every part of the body, including muscles. So if these brain parts are abnormally activated, when they are normally activated, for example, if I want to move this finger, that part of the brain gets activated and you move. Okay, if this gets abnormally activated, then those muscles move. That's why you see these movements as fits in common term or as convulsions. Convulsion is a motor component of a seizure. Seizure is abnormal electrical activity. So now we will have a question. When you have areas in brain for movements, you can have areas in brain for your thoughts, for your sensations like smell or taste. Can you have abnormal electrical activities in these areas also? Yes, definitely. So seizures can involve areas which are non-motor, that is without any movement. So you can have seizures with just an abnormal sense of smell. You can have seizures with just loss of consciousness, loss of attention. Okay, so any area in the brain can have abnormal electrical activity, and these are also seizures. You can probably call them as non-motor seizures. Similarly, you can have abnormal movements without electrical activity in the brain. These are called pseudo seizures. There is no actual seizures in the brain. Usually happens due to psychological problems. You have abnormal muscular activity, but there is no electrical activity going on in the brain. Okay, all this is technical. So what do these have real world implications? Whenever there is an abnormal electrical activity, this electrical activity needs to get treated. Okay, usually this electrical activity ceases after a time spontaneously. To abort this activity, you need medicines. These are anti-seizure medications. What is then epilepsy? Is epilepsy equal to seizures? We should understand seizure is an event. Okay, event happening in brain. What is epilepsy? Epilepsy is a disease with a tendency to have recurrent seizures. Okay, some persons have a tendency to have recurrent seizures. An episode of seizure may happen following a trauma. Your head gets injured, there is some bleeding that irritates that area in the brain, and you have convulsions or seizures. But some persons will have a tendency for recurrent seizures without any provoking factors. This is called as epilepsy. Epilepsy is the disease where you get recurrent seizures. So some persons can have seizures only when they have certain inducing factors. Some persons will have epilepsy, which is a disease where you have recurrent seizures with or without any provoking factors. So how do we diagnose these seizures or epilepsy? A seizure is an ongoing event which is very obvious if it has a motor or a movement component. Sometimes you have seizures of different types where you just have you lose your attention, called absent seizures. Where you are perfectly normal, you are sitting, you just lose your attention, then you come back. Those are called absent seizures. Where you have abnormal sense of smell, others don't have any abnormal sense, you have an abnormal sense of smell, and then it ceases to exist. These are very difficult to diagnose. During these times, if you have some abnormal events going on, doctors may employ certain tests called electroencephalogram or EEG, where the electrical activity in the brain is read. Okay, during you fix electrodes on your head and you read the electrical activities or electrical signals from the brain, and you diagnose seizures. Similarly, seizures may also require other tests, including your sugar levels, electrolyte levels, other blood investigations, sometimes imaging like CT and an MRI, because this abnormal electrical activity can be triggered by a low sugar, an abnormal electrolyte levels, or a injury or a brain lesion. So all these can trigger this electrical activity. So all these tests may also be required in case of testing or diagnosing your seizures. And what are the drugs? You have many classes of drugs which can be used to treat these seizures. You have two kinds of drugs. One is used acutely to abort the seizure activity going on. The other group is used to prevent the seizure activity from happening. So whenever you have an epilepsy, you need to take prolonged duration of these drugs. Usually this duration is 1 year to 2 years, and if you don't have any episode of seizure in between, your doctor will likely to stop, probably abruptly or more often than not, gradually decreasing the dose and then stopping these drugs. So stopping an anti-epileptic medication by ourselves without consulting doctor is not recommended. You need to take these drugs at the appropriate dosages for the appropriate duration. A person has had a seizure. Will he have it again? Is it lifelong? We need to understand, as I said in the initial part of the video, there are very many causes for these seizures. Some of them are due to provoked seizures. Like you had a low blood sugar level, you had a seizure. Like you have an abnormal electrolyte level, you had a seizure. Some of them are without any known cause and have a tendency to recur again and again. If you had a provoked seizure, specifically due to a non-recurring cause, you may not require a medication for prolonged duration. Whereas you have unprovoked seizures and you have epilepsy, the tendency to have recurrent seizures, then you may require medication for prolonged duration. All this will depend upon the diagnosis of your seizures. Similarly, kids can have seizures or convulsions provoked by fever, which I have made a separate video about febrile seizure. A newborn can have seizures due to some abnormal activities. So these are different classes of seizures. So depending upon your diagnosis, the duration and the treatment will also vary. So essentially, one episode of seizure doesn't mean that you will have epilepsy and you will have lifelong medications to go on. But what you need is a proper diagnosis by a qualified doctor to determine the duration and the mode of treatment. Even those persons who have a recurrent tendency to seizure or those persons with epilepsy, today we have advanced diagnostic modalities and advanced treatment modalities, including specific targeted micro and laser surgeries where these diseases can be treated definitively. You have taken 2 years of treatment, again you have recurrence of seizures, or even with medications, multiple medications, the seizures are not being controlled. You now have hope of these advanced surgical treatments for seizures. So seizures doesn't mean always lifelong medication. You have now advanced treatments. The only requirement is we need to seek the proper consultation. So some person convulsing at home or convulsing in the road doesn't mean end of road. So you have multiple modalities of treatment. What we need is proper assessment and diagnosis. Hopefully this would have cleared some of your doubts about seizures. This is a vast topic which can be dealt in hours together. This is just an eye opener. If you have any more doubts, kindly post it in the comment section. Whichever needs clarification, I'll try to answer in the comments or make separate videos on it. If you found this video useful, kindly share it among your friends and relatives. To view such videos, kindly subscribe to this channel. Till we meet again, bye.